Leslie Farrington, a practicing obstetrician-gynecologist on Long Island since 1989. If you've ever been admitted to the hospital, you'll know how unsettling it is to be a patient. You may wonder, is there any way you can influence the outcome? The answer is a resounding yes. Medical research shows that the informed and involved patient gets better outcomes. In 1996, my own mother died because she wasn't given preventive medicine after she broke her hip. Years later, my father was sick and he was misdiagnosed, which led to paralysis until he died 2 years later. My own family experience fuels the work I do with Pulse as a patient safety educator. The stories you're about to see show far better than any lecture could how results improve when patients and their families are active and knowledgeable participants with their healthcare team.
My mother was admitted as an emergency patient to a local hospital, and then she was subsequently scheduled for surgery. After the surgery, she had a violent psychotic reaction to the anesthesia that was used. She was then scheduled for an anticipated surgery 3 months later. I spoke to the urologist who was going to be doing her next surgery, and I explained to him what had happened. And I was able to do that because I had taken some advocacy training. And he heard me, and he listened to me, and I felt reassured. He heard me, and he did affect a positive change.
My name is Mirna Cortez. I work for Pulse. I am the community health educator at the Freeport trailer. We meet here with the worker, day laborer, every 2 weeks, and different topics about communication, about preventions, how to navigate the health systems. And I would like to share with you a particular case. There is a worker, 30 years old male immigrant who has been depressed and he didn't go to the hospital for help. And one of the reasons was because his English was very limited. After hearing the Pulse presentation about that he has a right to language assistance, he finally decided to go to the hospital. It makes a difference on him that he knew there was these services available for him. He got the treatment, he got the medication, and he's doing very well.
Hi, my name is Chira Budick, and this is my mom, Gloria Oken. 4 years ago, I was unable to properly navigate my 83-year-old mother through a healthcare crisis. Because we lacked the communication skills needed to express our fears to the physician, we were not prepared for the outcome of this. Pulse training has given me the tools and the knowledge to properly be informed and understand the dynamics of asking the right questions and knowing the right procedures. Recently, I discovered that I was much better able to deal with a new medical crisis. My now 87-year-old mother developed a very bad infection in her toe.
Little did I realize that the toe was as badly infected as it was, and if Chira hadn't gotten the doctor and got me to the doctor, I would definitely have lost the toe.
We were told that the oncologist would be here to see him today. And the head nurse was lovely. She made a phone call. And she handed the phone to me and said, the fellow's on the phone. And I said to the fellow, I introduced myself, I said, we've been waiting for you to come, when are you coming? And she said, I'm not. No one was coming in. And at this point in time, when I, was so used to being a part of the healthcare system, realized that I wasn't going to be able to do a thing about this, I started to cry. And my son, God bless him, said to me, Mommy, call Pulse. We made a phone call to Eileen, who's sitting right over there. She calmed me down. I felt that there was someone who was on my side. And together, we made an agreement that it was okay for me to be a wife and for her to be an advocate.
My mother is 89 years old and for the past 5 years has lived in a nursing home. Periodically, I'm called in to get a progress report. It goes very smoothly. I sit there, I listen, and then we say goodbye to one another. But all that changed last April after I attended a workshop from Pulse. They taught me how to advocate for my mother in a way I wasn't used to. This time at the meeting, I sat there and I said, I'd like to know what medications my mother's taking. I'd like to know what supplements she's on. And I asked pointedly what the dosages were. We went over them and I asked them to speak with the doctor and to make some modifications. And guess what? They did. I saw changes in my mother. 3 weeks later, she was a different person. She had been lethargic and just kind of sat in her chair. Now she interacted with me, her eyes were brighter, her appetite increased, and I have Pulse to thank for this.
We thank you for listening to our stories, and we hope they have shown how patients and families can partner with their healthcare team to improve outcomes so everyone benefits.